Hello, welcome back. The topic today is how obesity or fat affects hernia. Hernia is a very common disease. Usually, men will say inguinal hernia. Women mostly after the surgery, the stitches give way and give incisional hernia. Even hiatus hernia causing GRD, the acid reflux. These are all hernia. Hernia is nothing but the internal organ protrudes through the abdominal wall. So, suppose there is a weakest point or hole in the abdomen through which the intestine is coming out, it's called inguinal hernia. So, in that defect, most of the time because of the friction, the fat deposits. So, this fat can increase the speed with which the hernia increases. It can increase the speed at which the hernia becomes bigger. Number one. Number two, the fat sometimes adhere get stick to the intestines, causing obstruction complications. And not only that, when we go for the surgery, obese people, the anesthesia itself is a very risky one. So the fat, even if it's open surgery or the laparoscopic surgery, the fat, it bleeds. The stitches cannot hold properly. So the fat is it's not as strong as a muscle. It's like an individual tissues. They don't hold. So stitches, bleeding, these are all against the our hernia repair. The other reasons, the fat can be subcutaneous fat below the skin or central obesity inside the abdomen, the visceral fat. Both are against our hernia. So the visceral, the subcutaneous fat, when you do the open surgery or this thing, the bleeding, and the when it bleeds, the operative site, the operated area becomes messy. So the vision becomes lesser, so making the surgeon the proper repair may be little difficult. The same way the visceral fat, when it's why because of the visceral fat, the intestines moves very slowly, so they get constipation. So constipation is against our hernia. For constipation they have to push. When they push, the hernia becomes bigger and sometimes complicated. Obese people have a acid reflux, so they have a dry cough. When people cough, the hernia becomes bigger and becomes get complicated. And again, the immediate post-op period, obese people, with too much of fat in the body, so they can cough. So the stitches can give way even in the immediate post-op period. Or the fat is always as a like a it has a screwdriver like effect. It can go into the tissue. So when the mesh is fixed, if there is a lot of fat, fixation won't be that perfect. It can move. It can move after 3 months, after 3 years, so many years. And not only that, when the mesh is kept, the fat can grow between the tissues and the mesh, and it can push away the mesh, causing the recurrence. So that is why the success rate of the hernia depends mainly about the fat content of the body or the weight of the patient. So that is why most of the time the surgeons advise the patient to lose weight at least 5 to 10 kg before the hernia surgery. So if you're obese and if you have a hernia, and most of the time, if you're obese and most of the time they may not be, it's very difficult to diagnose the hernia also. So if you have a hernia and if you're obese, reduce your weight, get help of your surgeon and get the proper treatment. Thank you.